You know that feeling, right? When your shoulders are just seized up, or maybe there's that nagging pain in your knee and nothing seems to really fix it long term.
Yeah, we've all been there.
Yeah.
And often we jump straight to thinking about pills or maybe even surgery.
Exactly. But what if there are like really ancient ways to approach these things, ways that focus more on, well, getting your body's own systems flowing properly again? Still surprisingly relevant today.
That's precisely where traditional Chinese medicine, or TCM, comes in. It's been looking at health this way for, well, centuries. Not just chasing symptoms, but looking for the underlying imbalance.
Okay, let's definitely unpack this because we've got some really interesting material for you in this deep dive. We're zoning in on two specific TCM approaches, the warming transportation method and the strong transportation method.
Right. And our main source here is looking at how these are used in traumatology. So the injuries, strains, things that mess with how you move. We're drawing a lot from the work of Dr. Tsung-KUEI.
He's doing some fascinating stuff in this field. So our mission today really is to understand these two transportation methods. What are they actually about?
Yeah, what are the core ideas? What techniques do they actually use? And crucially, how are practitioners using them now, like in clinics today, to help people with all sorts of conditions?
Okay, so before we jump into warming and strong, it feels like we need to grasp a really core TCM concept first. Qi. What exactly is qi, and why is its flow so important?
That's fundamental, really. Qi in PCM is often translated as vital energy or life force. It's what animates us. And our sources really stress that when this qi gets stuck or blocked, the term is qi stagnation, it's a major player in lots of health problems.
Especially with injuries and trauma.
Exactly. Think of it maybe like a river. If you get a log jam, the water backs up, things downstream don't get what they need. It causes problems all over.
That makes sense. There's actually a quote in our material that really hits this home. In the development process of any disease, qi stagnation is the main pathogenesis that cannot be overcome. By clearing the qi, diseases can be cured. That's a pretty bold statement.
It is, and it underscores the importance. The source even says that acupuncture, at its heart, aims to regulate qi to make it smooth, thereby curing diseases. So restore the flow, and you allow the body to heal itself.
Okay, got it. Qi flow is key. So with that foundation, let's dive into the first big method, the warming transportation method. And the name itself suggests heat is involved. How does this work to get things moving?
Right, so this method, it primarily uses heat to tackle that qi stagnation we just talked about. It seems particularly useful when the stagnation is linked with what TCM calls blood deficiency.
Blood deficiency, is that like anemia?
Not quite the same as in Western medicine. It's more about the blood not carrying enough nourishment or vital substances effectively. It's a functional description. The source puts it plainly. Warming transportation method is a needling and moxibustion method, mainly using hot needle and moxibustion.
So heat is the main tool.
Exactly. Applying warmth and warm and hot stimulation is the strategy. The idea is to encourage circulation, dispel cold or dampness, which TCM sees as contributing factors to these blockages.
Okay. And within this warming method, there are specific techniques. The first one sounds pretty dramatic. Fire needle. It's called the big needle from the ancient 9 needles. Tell me about that.
Yeah, the fire needle. It involves heating a special solid needle until it's literally red hot. Then the practitioner quickly inserts it into specific points or affected areas. Very fast in, fast out.
Wow, red hot.
Red hot. It delivers a really focused, intense burst of heat right where it's needed. And yeah, the 9 needles reference, that points back to classical TCM texts describing different needle types for various purposes. The fire needle is definitely one of the more potent ones.
It sounds ancient, but our sources mention modern figures like Professor He Puren and Professor Shi Huaitang, even talking about new 9 needles. So this isn't just history.
Not at all. These professors have done a lot to research and refine the technique for modern use. It's very much a living practice. And the source gives concrete examples of how it's used now.
Like what?
Well, for instance, improving varicose veins in the legs. You can sort of picture how that intense heat might stimulate circulation where blood flows become sluggish and pooled.
That's definitely a different take on varicose veins than you usually hear about.
Sure.
What else?
Another really striking one is treating gout. The source mentions seeing uric acid crystals actually being drained after fire needle treatment. It's very direct.
Drained, wow.
Yeah, in TCM terms, clearing heat and dampness and getting things moving in that painful joint. It addresses the crystal buildup.
That's quite an image. Any other examples for the fire needle?
It's also used for things like subcutaneous cysts, Those lumps under the skin, maybe under the chin or elsewhere, and even plantar corns on the feet, which can be really stubborn. So it seems quite versatile for localized issues, blockages, accumulations.
Okay, so that's the fire needle. Still under the warming transportation method, there's another technique involving heat. Moxibustion, or AIA. People might have heard of burning moxa, but the source highlights a specific type called thunder fire needle. What's special about that?
Right, so moxibustion generally uses the heat from burning dried mugwort or moxa wool, but the thunder fire needle, it's like a turbocharged moxa spit.
Turbocharged. How?
Well, besides the high-quality moxa, it has added medicinal powders mixed in. They actually use special machines to make these sticks with the herbal formula integrated. So you're getting the heat therapy plus the specific therapeutic actions of those herbs.
Ah, so it's heat plus herbal medicine combined. How do they use it?
Typically, they light the thunderfire needle. The source mentions a spray gun, probably for an even burn. Then they hold it over the acupuncture points or the area that needs treatment. But critically, they use layers of gauze between the stick and the skin.
To control the heat.
Exactly, to prevent burns and deliver the warmth precisely. The source even specifies using about 12 layers of gauze for maybe 12 seconds. It shows you the level of control involved.
Right. It's not just randomly waving a burning stick around. Okay, that gives us a good feel for the warming transportation method. Let's switch gears to the second category. The strong transportation method. The name suggests something, well, stronger. What's the idea here?
You got it. Strong transportation is more about directly tackling key stagnation, especially when it's mixed with what TCM calls blood stasis. Blood stasis is like a more severe traffic jam in your circulation. Things are really stuck.
So this method forces things to move.
Pretty much. It aims to actively promote movement and break through those blockages. The source says, strong transportation method is a strong stimulation method using bloodletting sheets, 3-edge needles, or using minimally invasive acupotomy to loosen adhesions. So strong here implies a more forceful intervention.
Okay. And like the warming method, there are specific techniques. First up is bloodletting. Sounds intense. What does this involve in TCM?
Well, it involves making tiny punctures in superficial blood vessels, usually near the skin surface, to release a very small amount of blood. It's not like historical Western bloodletting. The source mentions special tools, bloodletting instruments, and 3-edge needles.
Specialized tools for this too.
Yeah, and interestingly, it connects the nash, the bloodletting sheet or lancet, to the sharp needle from those ancient 9 needles. It was specifically designed for releasing stagnant blood.
So deep historical roots again. Is it used today? Any examples?
Yes, the source gives the example of treating varicose veins in the legs with bloodletting. So that's another TCM approach to that condition, focusing directly on the stagnant blood aspect compared to the fire needles warming approach.
Interesting to see different strategies for the same issue. Okay, the second strong transportation technique is Acupotomy. This sounds like maybe a newer development, maybe blending ideas.
That's a really good way to put it. Acupotomy is presented as a minimally invasive technique that bridges TCM and Western medicine. The definition given is a method created on the basis of Western surgical therapy and traditional Chinese medicine acupuncture therapy.
So combining surgery and acupuncture ideas?
Sort of. A key point is that it can loosen soft tissues without incisions like traditional surgery. But it's more targeted than standard acupuncture for things like adhesions or tight bands in muscles and connective tissue. It's described as an organic combination and development of both fields.
Fascinating. Who developed this?
Professor Zhu Hanzheng is credited as the inventor, and his guiding principle, according to the source, was acupotomy is the main method, and techniques are supplementary. Equipment subsidies and drug coordination. Really highlights the procedure itself.
And there are different instruments for this.
Yes, the source mentions various small acupotomy instruments. Think tiny, specialized blades or hooks, designed for very precise work within tissues, releasing tension and adhesions without needing big cuts.
And what kinds of problems is acupotomy used for?
Oh, quite a range. Things like ganglion cysts on the wrist or knee, lots of musculoskeletal pain, neck, shoulder, back, leg pain. It specifically mentions treating cervicogenic headaches, headaches coming from the neck, tinnitus, vertigo, even eye coordination issues by releasing tight muscles at the base of the skull.
That's amazing, connecting neck tension to things like vertigo or tinnitus. What about bigger structural issues?
Absolutely. It's used for lumbar disc herniation and spinal stenosis. And they show results. like measuring how much further someone can bend forward after treatment. Really tangible improvements.
Quantifiable results, that's compelling. Does it apply to other joints too, like shoulders?
Yes, definitely. The shoulder comes up specifically. Right. Treating rotator cuff calcification, those calcium deposits, and releasing the coracohumeral ligament, which can get tight and restrict movement. And this is where modern tech comes in again. I mentioned using ultrasound guidance for these shoulder procedures, so the practitioner can actually see the needle and the tissues they're targeting in real time.
Wow, ultrasound-guided acupotomy. That really blends old and new. So these two big methods, warming and strong, are they always used separately or can they work together?
That's a great question. They're definitely not mutually exclusive. The source makes it clear they can be combined strategically, depending on what the patient needs. It says, clinical studies have found that warming therapy and strong therapy have significant efficacy and fewer side effects for common traumatic and surgical diseases.
And for really tough chronic problems.
For those, the source suggests combining them with acupotomy can be especially powerful. There's a great quote. For chronic and stubborn diseases, applying warming therapy and strong therapy to assist minimally invasive acupotomy has a more significant effect.
And you mentioned the ultrasound guidance again. That integration of modern tech feels really significant.
It really is. Using tools like ultrasound to guide acupotomy makes the procedure more precise, safer, and likely more effective, especially in tricky areas like the shoulder joint. It's a perfect example of not being stuck in the past, but enhancing traditional wisdom with modern science.
It shows how these therapies are still evolving. So looking at the big picture from our source, what's the overall scope? What kinds of conditions might benefit from these warming, strong, and acupotomy approaches?
It's surprisingly broad.
Yeah.
Of course, there's the whole range of musculoskeletal issues, neck, shoulder, back problems, joint disorders, soft tissue pain.
Yeah.
But the list also includes things like neurological issues, maybe post-stroke recovery or nerve pain, some gynecological problems, even some internal medicine conditions.
Wow, that's wider than I might have guessed.
It reflects that holistic view in TCM, where restoring flow and balance can impact many different systems. The source even has these neat little formulas summarizing acupotomy's development.
Oh, yeah. Like what?
Like acupuncture plus anatomy, acupotomy, showing how it merges traditional channel theory with detailed Western anatomical knowledge, and then acupotomy plus science, acupotomology, pointing towards its ongoing scientific study and refinement into a distinct discipline.
That really encapsulates the journey. So wrapping things up, it seems these warming and strong transportation methods are really powerful tools in the TCM toolkit, stemming from that core idea of tackling key stagnation.
Absolutely. Using techniques like fire needle, moxibustion, especially that thunder fire needle, plus bloodletting and acupotomy, all aimed at getting things flowing properly again.
And the integration piece is key, right? Ancient knowledge meeting modern tech like ultrasound.
Precisely. It's not static. It's about leveraging centuries of practice and insight, but also enhancing it with today's understanding and tools for better patient outcomes.
It definitely makes you think differently, doesn't it? When you have those persistent aches or limitations, considering this perspective, focusing on flow, on blockages, it offers another way to look at things, maybe prompts you to explore if these kinds of approaches could be relevant for your own situation.
Yeah, this deep dive really shows the staying power and, honestly, the ongoing excitement around these TCM therapies. There's this incredible depth of history, but it's also a field that's clearly still developing and offering new potential ways to support our health.